ओसे जी अनम्यूट करो, आप म्यूट हैं।
Yes, sir. Yes, sir. Good morning, sir.
So, good morning, everyone. I hope I'm audible to everyone. So, good morning, everyone, once again. Respected Dr. G.D. Gupta, sir, Principal cum Director of ISF College of Pharmacy, Moga, and Dr. Saurabh Kose, Head of Department Pharmacy Practice, ISF College of Moga, and our esteemed guest speaker, Dr. Amresh Srivastava, for today. So, we all have gathered here for this webinar on the challenges that we face as students. So, Dr. Amresh Srivastava, he has been acting as the Professor Emeritus at the University of Western University at Ontario, Canada and London. And currently, he is the Director of the Mansik Shakti Foundation in India, that is set up in India. We welcome you also. We are very honored to have you here. The whole ISF College of Pharmacy is honored to have you here. So, without wasting much time, I'd like to invite you, sir, to go ahead and start the webinar. Thank you, sir.
वेलकम सर।
Good morning to everybody at IFS University of Pharmacy. Respected Shri Gupta ji, Shri Kose ji, and Shri Hussain ji, I am thankful to have this opportunity to talk to all of you and extend my thanks for wonderful collaboration that we have developed. It's a great opportunity that I enjoy talking about problems which nobody touches either in the campus of university or outside. We often see some reference to it in media, and therefore the interest in this topic is currently generating. It is really important to think about our children who go to university campus. There was a time we never got worried when our children went to university campus. We were confident that they will complete their studies and come out with flying colors. But today the situation has changed. More and more parents are more worried about how will my ward do in the campus. Will he be lonely? Will he suffer from stress? Will there be any problem? They're not worried about how much marks they will get or what will happen for their future career. And this is the main concern. Despite this, the situation in our country is not satisfactory. You take any institution, not only mental health, but even resources for physical health is also lacking. On one side, we have problems of awareness for health conditions. On the other side, we have challenges of psychological field. And on the third side, it is the stigma which everybody faces. Stigma, which is a social condition deep rooted in our society, which prevents each and everyone in our country to openly talk about or go to receive help to anybody. People don't talk about it in families. People don't talk about these problems amongst friends, with the teachers and mentors, and they suffer in silence. And sometimes this suffering becomes very acute. I will show you a video for our program that we have developed, and that is one kind of answer that we have decided that it may work. And from answer, we will move towards explaining the problem. Give me a second, please.
Please open your. Sir, please open your mic, sir. Mic.
Is that okay now?
Yes, sir, you're audible.
All right, thank you. So the topic that we will touch upon today is navigating the challenges of students' life. And as I said, it is the health condition is one of the most important determinant for the performance, excellence in education, and even for future life when you go for employment, etc. Let's not forget that in our country, about 15,000 students succeed in killing themselves every year. And about 10 times of this number are the students who attempt to harm themselves or kill themselves. They are admitted in the hospital, they are treated and sent back to the university, to the homes. When they come to their colleges, everything is same for them. Nothing has changed, same competition, same pressure, their inability to express. There is nobody to talk to them about what they have gone through. And overall, they are seen as victim of their own problem from a distance, from the closest friends. There is so much misunderstanding about the problem. Why does suicide happen? It is just one marker of what our students are going through. And it is not that it is only a problem in our country. It is a problem across the world because young people are very sensitive. They are very, very vulnerable. Precisely because the mental health challenges that they are suffering from remains untreated. No one feels responsible. No one takes responsibility. And there are consequences like falling out of educational achievement, leaving the school dropout, getting into the habits of drugs and alcohol, becoming reckless in their driving, change in behavior, developing symptoms of physical health like sleep, loss of appetite, so on and so forth. What happens next is a very poor social relation. Their capacity to connect with people in family and outside becomes poorer and poorer. I'm not only talking about stress factors, but I'm trying to refer to overall mental health development, overall mental well-being of students. One should, whether teachers or principals or parents, must pause and think why this is the situation and what can be done. We believe that one of the answers for our students is empowering minds, is to empower them, inculcate a belief system that yes, they can solve their own problem. They do not need to succumb to advice of anyone. They are intelligent enough to dissect, understand the problems they face. The problems like loneliness, hopelessness, helplessness, inability to speak, feeling stressed. What is there that they cannot experience, that they experience and cannot understand? Yes, they can understand. But the problem is they don't speak and don't share ideas because stigma is so very vast. They all feel and become victim of misunderstanding that they will be judged, they will be seen as a poorer soul than the others. They don't know that they are not alone. 20 to 25% students suffer from one or the other kind of problem. We firmly believe that we had to hand over the power of making decisions about young individuals in their own hands. It should not be the condition that they have to be guided all the time what to do, what not to do. They are adults, rightly so they can decide. They have a power of decision making about everything, and therefore empowering them is most important. We will see what are the methods of empowering young students for being healthy and for growth and development of mental wellness. Now let us understand mental health is for academic achievement. This is a new way of and factual way of looking at the problem of students. If there is anything which stands between them and their success as a student, it is only their mental health. If you are intelligent as you are, you do hard work, you are in the best of the best institution, you have best of the best teachers, mentors, but if you cannot focus, if you cannot discipline yourself, if you do not understand the importance of time management, if you don't recognize that your mood goes through variation, if you suffer from severe anxiety and perspire in your palm, if you become anxious before going to exams, or when you go to exams you develop blackout, or you suffer from problems of memory and concentration. Similarly, there are hundreds of issues which creep into minds of students. And that is why, again, often you see students who are very good in academics and they start falling. So mental health is closely related to overall life of our students. Now you would say, what is the evidence? Research has significantly made progress and established that if you deal with the mental health challenges, you improve students in their academic performance. Not only this, if you improve academic achievement, their mental health also improves. So it is bi-directional relationship with mental well-being and achievements and success in academic field. Now it's a broader question, why should we talk about students? We have about 40 million, 4 crore students in universities and about 22 crores in colleges and schools. And also we must remember that 1 out of 2 youth is not in any institution. They are not in the educational stream. We are talking about a significant population of our country. But that is not the way, that is not the factor why students are important. Students are rightly very specific population due to a number of reasons. It could be social, biological, or a health reason, or environmental reason. We will see what it is. Let us also understand that every citizen and every parent, everyone has this idea that students are always healthy. They are young people, robust, physically smart, and nothing can happen to them. And this fact is also not correct. There is a lot of data, and I will show you how that 1 out of every 2 students is having problems of either physical health or mental health or social health. Understanding these students from a new perspective is most important. Students are special. As I said, it is not because of a population which is going to shape the future of our country. That's one argument. But There are a number of other things, like they are in a crucial age when the brain is developing. Its neurons are maturing. They are developing new connections. Whatever older connections they had developed between 5 and 10 years gets more strengthened. Every neuron is related to various psychological functions. Therefore, if they develop any psychological problem in the age when the brain is growing, it gets deep rooted and their personality gets affected. That's most important biological reason why students are a special population. The second, when we examine patients who suffered serious mental disorder, and we ask them, tell me, when did you feel the first symptom of the illness? 75% people who suffer from serious psychiatric problems when they grow develop their first symptom between the age of 14 and 17. A symptom which appears during this age is quite resistant to treatment. And it's a marker that when this gentleman grows, he is more likely to develop a mental disorder. That's one of the important reasons why we should look at this population as vulnerable population. We also should look at this population as a window of opportunity, because we can do something to prevent the future mental disorder. As I said, the brain grows. Along with that, various psychological functions also grow. Your ability to calculate, your ability to count, mathematical ability, language ability, your personality contents, the way you will behave, how you will connect socially, all these factors are important. The next very important factor is social development. Social development precisely takes place between 14 and 18 years of age. They learn how to connect to environment, how to connect with fellow colleagues, how to connect with larger components of society. Not only this is the age when they develop the philosophy of life. They understand the meaning of life. They develop a thought process for their nation, for society, for a larger good of human being. These are the reasons that students are important, and we must think differently, cultivate facilities, generate resources, educate them, and bring them to a level where everything goes right for them. As I said, about 1 out of every 2 students suffers from one or the other problem. If we start counting that, I will show you the numbers. The study that we did, and likewise many other studies, what have they shown from university students? Only 25% students express the idea that they don't feel stress, and 30% express that they feel severely stressed to the extent that their life is significantly affected. Besides that, there are about 10% students whom we describe that they are at risk population. They do not have symptoms of mental disorder, but they have some symptoms which might develop into a mental disorder. These are a population at risk. Further, there are about 10 to 12% students who do not have a mental disorder, who do not have a psychological illness, but they have psychological ill tendencies. They have limited resources of their mind to deal with the situation. Somebody has poor coping skill, somebody has problem of adjustment, somebody remains absent from the college, many have hesitation in joining the mainstream like sports, debates, and other activities. So many students have habit which they want to disclose, but they are scared, they are afraid to open up. These are psychological symptoms of psychological ill health. They are not illness, but psychological ill health. Further, you will find that about 5% students in a community are such, they are having severe burden of illness amongst their parents. Either they have physical disability or they have mental disability, but when the student comes to the college, he is burdened what is happening back home in my house. Thus, we see that about 50% population of students needs some kind of help. Now, the focus is today, we want mental well-being. Their holistic approach to translate mental health into mental well-being. Now, what do we mean by that? Let me explain. If you define stress or mental conflict is the first symptom that you experience in any problem. You become late to reach somewhere or you have financial burden. The first symptom to appear is that you get worried. What is worry? Worry is a psychological symptom. So there are some psychological functions that we all have, like ability to read, write, ability to understand, ability to analyze situations. These are normal psychological functions, and when these functions get affected, a problem in behavior or mood or what we call it psychological illness may begin. But this is not the total story. There is another set of functions that everyone has. I prefer to call those as psychological virtues. For example, your ability to trust your friend, your ability to communicate, your ability to forgive, your ability to believe in something, and your ability to develop friendship or volunteer or help or be resilient, having enormous coping ability. You can face challenges someone else cannot. These are the qualities of human being which are called psychological virtues. And man will be defined about the quantum of psychological virtues that one has. A good function of psychological virtue is to deal with the challenges. Those students who have high quality of psychological virtues deal with their problems much differently. They are used to consider options in their life. Now let's take an example of self-harm or suicide. Why does it happen? One theory we say that people run out of options, they cannot see alternatives. Yes, it is true. But there are students and young people and adults who have firm belief in finding out options. For example, you are driving or going on a road and there is signal, it's crowded traffic. You will always find one or two getting out of the lane and finding by lanes to cross and going ahead. This is a very, very primitive example of finding out solutions of complex problems in a simple manner from the resources that they have. And this quality is a quality of brain architecture. Those people who have high psychological virtue are able to solve their psychological problem. They can lead much better psychological life and spiritual life than other people. If we want to reform someone's mental health or mental well-being, our approach should be, besides talking psychotherapy and medications, our approach should be to inculcate positive mental health. That is a definition given for psychological virtues. To find methods and treatments so that we can improve the factors of trust, hope, optimism, resilience, faith, etc. So this is very important to realize whether our system is geared up to generate these resources and help students or not. But believe me, these are grossly absent across the board. People don't think of it. Even the school prayers, which are supposed to provide these characteristics, are many times absent from many institutions. And then we start talking about stress. Whether it happens in 40% or 50%, that's not the issue. The issue is why people feel stressed. And what is stress? Stress is typically the body's response to any specific threat. When you realize that you cannot cope, you cannot deal with it, you develop many symptoms. It can be symptoms of body or it can be symptoms of mind. Both put together constitute stress. Commonly seen stress among our students is, everybody knows that it is academic stress because of courses, because of lack of opportunities, because of unsurety, competitiveness, etc., is a permanent source. Moment they enter the campus of a university, they start doubting their ability and the prospects after college. And that is one of the major sources of this stress. Of course, some people have problem of housing, health, finance, traveling, parents' disease or health condition among themselves. These are also very important. But most important in a student population is academic stress. I would not say that stress is the only challenge they have. Stress is the final common pathway for all other problems that I mentioned. Whether it is resource in a college, availability of literature, or having good teachers, or their ability to solve problems, whether it is internal or external, they all generate a capacity which may enhance their confidence or which may dampen their confidence. The moment this happens, they feel stressed. As I said, about 60% students experience stress and about 30% in our universities. This is the research data in our country, feel highly stressed. Do we have any mechanism of dealing with these individuals? We are unable to identify. Not that we cannot, but we don't want to. There is no structured mechanism in the student population or in the college or university where they can find out whether they are suffering or not suffering. They also cannot determine how much is too much, how much stress is really bad, how much stress is not that bad, what is positive stress. If everybody has a stress, why is it that some people succeed and some do not? There are short-term and long-term consequences. Some people will develop panic, anxiety, depression, and addiction. Others, when they grow, will develop diabetes, problems of blood pressure, arthritis, and skin conditions. These are well-known conditions related to stressful conditions. Stress either in earlier life, in childhood, or in ongoing contemporary times. They feel stress and their health suffers. So outcome of most often this stress is not managed. So what happens? What is the outcome? As I said, some of them develop depression or anxiety or develop addiction. How do we manage? The mechanism of management is most important for students to know, whether it is a psychological mechanism or it is non-psychological mechanism. You can work on improving the condition which creates stress, or you can provide resources for students for counseling, talking, therapy, developing peer support, etc. But basic thing is that whether you are able to identify, recognize or not. What we have found and the world is looking at today is that positive component in individual, as I said, the psychological resilience. Stress is counterproductive to resilience. It is found that those people who have high resilience are less likely to develop stress. Those candidates who have high scores on optimism, trust, faith, and resilience can develop a good coping ability, can have good sense of options, alternatives, and they deal with the challenges very well. So one factor which is within us, which deals with the stress, is developing resilience. If stress and resilience run in an inverse direction, then it's a win-win situation. But there are situations where resilience is high, but stress is also high. Now, these are the cases which are potentially dangerous. We must recognize that why, despite having good psychological capacity to deal with situations, some of them are unable to do so. What are the conditions? Definitely their mental well-being is compromised. They have something else than stress. So which stress is bad? If we say the stress where early signs of mental disorder has developed, the stressful condition which has social complication, which has poor level of functioning, which has created behavioral problem or changed the personality, these are the cases where stress management is difficult. It is possible to do so, but it needs a hard work, a good strategy. And the first part of the strategy is to recognize, identify, and the second is to quantify. While I'm talking all this, I believe that there is a need for transformation of concepts with which we work. It is not only that your bones have to be strong and your muscles have to be strong and you are a good, fine person. No, that's not the case. Our concept needs to be changed, that we want to deal with the situations which create problems of health. I mean the risk factors, risk situation, and people who are at risk because of whatever condition. It may be poor housing, it may be transport condition, it may be bad environment in the college or school, or it can be low socioeconomic status in the family, or it can be even trauma during childhood or abuse during childhood. All these are conditions which are closely linked and associated with development of mental health problems. The approach should be not only to try and find out who is suffering from a mental disorder, but to also try and find out who is likely to develop a mental health problem in future. So reformation of concept is one of the academic requirement for mental health education, even in professionals. High risk conditions are directly related to the number of proportion of population that students will suffer. If a subgroup is having high risk condition, that subgroup is likely to have much higher prevalence of conditions like depression and diabetes. There are many risk conditions. I don't have to mention, you see them time and again in yourself, in your peers, the presence of a mental disorder, presence of problem in the family, your school conditions, your childhood events, etc., are the risk factors which are of current focus of intervention. Besides that, mental illness may be present, mental health problem may be present only in 20 to 25% of students. But what can we do for rest of the students? Everybody goes through mental health development. Like you grow in your body weight, in your height, similarly, your mind also evolves. It starts evolving right from the day you are born. Early days of life, the speed and quality and quantity of mental health development much more matters. The relationship between your parents and the relationship of parents and the child in a childhood age, when the person is vulnerable, people who have suffered social isolation, trauma, tragedy, etc., their mental health development suffers. They may not develop mental health problem today, but they are the candidate who will develop problem tomorrow. And we need to identify people who has poor mental health development. So the entire population which does not have mental health issues needs care, caution, and support. It may be in form of recreation or sports or social relationship or involving in voluntary activities or spiritual or religious sense, whatever it is. But something needs to be done so that positivity can arise and take firm roots, resilience develops so that they are able to deal with lifetime challenges which will arise in their career. Mental strength and psychological traits, as I said, are the hallmark of individual's life to deal with situation. Presence of resilience will allow you to deal with trauma. Now, based upon all these facts, we developed this organization, Manasik Shakti Foundation, and started developing instruments to measure, quantify, and then to digitalize. Taking it to everybody, Digital India offers a great opportunity to spread it across the length and breadth of our country. Let there not be a single institution without facility of dealing with students' problem. Let every student have the resource to access care. It is the question of their human and civil right. They need support. Now the question is, how do we develop that? There are many mechanisms. Every college can have a mental health clinic or mental health department, but that's not enough. Stigma is so rampant that students don't go and open up. And therefore, what we believe is to empower students to develop mental health strategy. Allow them to identify, allow them to develop strength to reach out. And this is what we are doing. I think I'll stop here and I'm ready to answer the questions that you would like to ask. I think I have spoken enough, and if there are questions, I'll be happy to respond to it. Thank you very much for this opportunity.
Wonderful session. Thank you so much, sir, for your enlightening talk. And definitely, it is one kind of in recent the requirement for our students, and they are going to face the examination in this couple of weeks ahead. So this will definitely make them come. The crux of your presentation will definitely make them vitalized So once again, thank you from ISF College of Pharmacy, sir. And I would like to request audience, if they have any queries and questions, come forward your mic and you can ask to the sir directly. If you have any kind of query, please do ask.
Excuse me, sir. I do have a question.
Yes, go ahead.
So, if I know that I have some unhealthy coping mechanisms that I shift towards when I get anxious or I'm stressed in life,
Right.
so how do I completely stop using those coping mechanisms and shift to a new coping skill or build a new coping skill so that I don't stress myself more?
I think this is most important and direct question. That here is a student who recognizes. That's what we have been saying, that students have the capacity to recognize. Now the question comes is to identify. She would like to know what is the specific problem with her. Is she suffering from a mental health problem, or it is only a psychological ill health? Is it a personality problem or something else? Now, this can be determined by your counselor. If you have access to a school counselor, talk to her. Let the first duty is to rule out the possibility that somebody will develop serious mental disorder. After this has been done, then we need to teach the methods of enhancing coping ability. And if you ask me, uh, the inculcating psychological virtues and relaxation and stress management are the best style. Now, let us see why this happens, why these shortcomings appear. They appear because of fear, because of the fear of either succeeding or not succeeding, or achieving or not achieving. One needs to get out of this whole mindset and develop a healthy coping mechanism. If you realize, and it can be done during sessions of counseling, that end result is not in your hand, you need to really work in the direction that you are supposed to be working. You may prepare enormously, but if you develop conditions which are out of your hand, for example, you develop fever or you fall down, develop injury, you cannot appear in your examination. So end result is not something one should worry, and we are always worried about what will happen as a result rather than focusing on today's condition of preparation. Preparation is important, but be mindful that preparation alone is not enough. What is the event in life is undetermined. I think I would highly recommend um, the principles of Bhagavad Gita for students, which teaches cognitive science in a great manner, which will allow them to enhance their capacity. Besides that, psychological methods of relaxation, talking and sorting out your conflicts are always there. So it is all doable. You must reach out to a counselor or try to develop your own mental strength by your text, reading text, developing, talking to your friends, maintaining a diary or journal, writing your fears, and winning over. So the tests that we have developed, there are 7 psychological tests. I talked about the app. The last 2 tests are for resilience and level of functioning, which are known tests of mental strength. Once you measure it, you will come to know whether you have poor resilience or high resilience, and you can work on developing resilience in your life. So this should be my answer.
Thanks a lot, sir.
If any other question is there,
No, they will take time to open up and think amongst them. If you have questions, you may write an email to mansikshakti@gmail.com and we will reach out to you.
We will share the sir number and mail ID of yours to the students. They can connect to you directly if they want to
Yes.
have any.
mansikshakti@gmail.com is the email we use for students.
Definitely, sir. Keshvi, over to Keshvi.
Thank you so much, sir, for this wonderful session. I hope we all learned a lot about the resilience, the importance of building the emotional intelligence among students, how the stress is building up in the form of, it's manifesting itself in the form of physical health problems. We all are thankful for this webinar, sir, and it was really great having you here. Thanks a lot, sir.
Thank you very much.
Just a minute. So, sir,